Hello, I'm excited to be sharing my experience with an adverse drug reaction with you today. This can happen to anyone, and I hope at the end of this short video, you will be well informed. Enjoy watching.
Please keep in mind that this video will have disturbing images of Stevens-Johnson syndrome. What is Stevens-Johnson syndrome, SJS? It's a rare form of adverse reaction. It's commonly caused by a severe reaction to medication. It is life-threatening. It affects the skin and mucous membranes. It has long-term debilitating effects on survivors. Visit www.sjsawareness.org.uk for more information. Who was I before? I was a teenage girl in 6th form, studying French, art and government. My experience with SJS has been a major turning point in my life, but my faith in God kept me going.
The acute phase of SJS. It all started in January 1996. I reacted to Septrin, which was prescribed to treat malaria-like symptoms. The next day, I had a burning sensation in my mouth and my eyes were looking red. Thankfully, the dermatologist who saw me at the 37 Military Hospital was able to diagnose and start treatment for SJS without delay. I was in hospital for 6 weeks.
Acute phase of SJS. I was in a coma for a few weeks and lost all my finger and toenails, and all eyelids were turned inwards. It looked like I had burns all over my body. I distinctly remember my mom saying to people, "Please go out if you will cry." I had no idea of the horrific state of my face. Recovery phase. After a few weeks, my skin started healing beautifully again. A life-altering experience. The long-term effects of SJS varies for each individual, but there are some common lingering effects on parts of the body with mucosal membranes. These include oral health and dental issues, ear, nose, and throat-related issues, genitalia-related issues, issues with other internal organs, vision and eye health issues, memory issues, depression. Long-term. I have had my fair share of these effects over the last 2 decades with regular hospital visits and procedures. In 2005, I was confronted by a reality of having a new, normal way of living after I was involved in a road traffic accident and fractured my right knee. My vision had deteriorated significantly, and my eyes had become photosensitive. The bright and sunny days were now an onset of misery for me. In 2010, I had a procedure on my right eye to remove scar tissue between my eyeball and eyelid. The photograph on the left shows me before the surgery and the left after my surgery. Life in the community, retraining and charity work. Retraining. I spent the 2009 to 2010 academic year at the Royal National College for the Blind, RNC, retraining to upgrade my office skills using assistive technology. I also had rehabilitation to empower me to live independently within the community. After this, I started the charity SJS Awareness UK, SJS UK, in 2010. Since I had a passion of helping and supporting people, I decided to use my experience for the benefit of others in the community. Visit www.sjsawareness.org.uk for more information. SJS UK. Since establishing the charity in 2010, SJS Awareness UK gained charity status in 2013. Together with other survivors and supporters, we presented a petition to the MP for Barking, RRT Hon Margaret Hodge, and launched our awareness campaign poster at the Westminster Hall. SJS Awareness Campaign launch at Westminster Hall with MP for Barking, NHS Chair for Pharmacogenetics, and lead research nurse at UOL. Award Ceremony. SJS UK volunteers at Starting Point Awards Ceremony Night in Barking. Patient and Public Involvement, PPI, for Adverse Drug Reactions meeting in Barking. Community reception for voluntary organizations with the Mayor of London at City Hall. Nadia with consultant and other participants in a training session for ophthalmologist in rare eye diseases at Queen Victoria Hospital.
Hope you've learned something from this short video and you are now well informed. You have enough information to be able to identify the onset of an adverse drug reaction and save a life. If you know someone or yourself is fond of self-prescribing medication, consider desisting from it. This condition is a medical emergency.